Today, mental health issues are no longer a 1 in 100 case. Due to drastic changes in lifestyle, higher levels of peer pressure, and in general a hectic lifestyle, people today experience lower levels of good mental health. And the problem is not just limited to working people or adults in general. Even children of today, young adolescents, even they struggle with mental and emotional health. And to add to the problem, there is an immense cloud of taboo around the topic of mental health. People tend not to disclose having problems on the mental health front and often suffer in silence, presumably due to the fear of judgment from the Indian society. This way, the issue goes unaddressed for years and may lead to unfortunate cases of self-harm or even suicide in some unfortunate cases. So we have today with us Mr. Shiv Kumar, who is a recognized psychologist, and he is here with us today to talk about this issue. Mr. Shiv Kumar academically holds several professional qualifications and is currently working as a counselor with the National Career Service, that is the Ministry of Labour and Employment, Government of India. He also holds expertise as a psychological counselor, a clinical psychotherapist, and is qualified to conduct psychometric assessments and formulate strategies as to how to restructure the pattern of irrational thinking in dysfunctional persons. He has a rich experience of more than 30 years in related sectors. Mr. Kumar works as a professional counselor for IDEA. We all know that IDEA offers a wide range of services, one of them being academic counseling. Mr. Kumar plays a vital role in our scientific process of counseling students. In addition, he guides IDEA's core teams with the perspective in other research interventions. Now, according to Mr. Shiv Kumar, psychology is an essential aspect of life for individuals of all streams and stature. And to help the society with his expertise, he engages with educational institutions to guide the students of today in aspects of team building, motivation, and research. So we'll begin, sir?
Yeah.
Shiv Kumar, sir, the first question that we have for you is, what exactly constitutes mental health?
Mental health is an internal equilibrium or a dynamic state which includes the emotional, psychological, and social well-being, wherein every individual identifies his or her own potentials and limitations. So basically, the emotional and psychological health of oneself is our mental health. Just like our physical health, which relates to our body, mental health refers to our mind.
Sir, so how do people exactly recognize that they are mentally ill or that they have ill mental health?
Yeah, that's a good question. Mental health, like physical health, does not show any outward signs. So when we break our leg, we know our physical health is not doing because we can see the signs of illness. But through diagnosing or recognizing ill mental health is often trickier than we might think. But generally, there are signs that we can recognize to ascertain the state of our mental health. By observing and examining the changes that happen in our behavior pattern and attitude towards others, we might be at a risk for ill mental health. Such signs may be losing their sense of humor, being erratic, unusually agitated, tearful, or conversely emotionless. Then changes in their appetite, weight, or even sleep hygiene pattern also takes place. In addition to that, there may be increased alcohol consumption or maybe addiction for drugs or substance abuse also might take place.
Thank you so much, Shiv Kumar, sir. I think knowing that what the signs of ill mental health are is the first step to recognizing that we have ill mental health, or sometimes, our friend or relative or someone we know might also have ill mental health. So that was very enlightening. So what are the major mental health issues that the students of today, that is the student community, struggle with today, and why?
Yeah, perhaps even everybody observes nowadays students are facing or struggling with mental health issues. Issues are caused by a number of factors that affect human development at the prenatal, natal, postnatal stages of developmental life. In general, the causes are considered to be a variety of genetic disposition, environmental factors, childhood abuse, and trauma are biopsychosocial factors like fall in academic grades, and then even effect of social media. As we all know, adolescent children also face many stress-inducing situations in life. Society has evolved, and life is not as simple as it was for the older generations. There is immense pressure of expectation from families, teachers, peer groups, and society in general. Nowadays, right from young age, children are expected to make mature decisions pertaining to education, career, life. Teenage dating is also a normalized enough concept in society. The issue of alcohol and drug abuse is also known in student community. All these issues, although not openly addressed by the Indian society, are prevalent and culminate into inducing stress and depression in children of tender age. In medical terms, the major mental health issues that students of today suffer from depression, anxiety, mood disturbances, addiction, and substance abuse.
Thank you, Shiv Kumar sir. I think I, as a student of the college community, was very well able to relate to all the causes of poor mental health that you've stated right now, especially the effect of internet and social media, and the kind of presence that we have in front of the world is indeed very stress inducing. There are a lot of expectations from parents and teachers to, perform well in academics, have a good career, go for studies abroad. So I think that has a very major effect on our mental health that sometimes students like us do not want to recognize or acknowledge. We'll
Yeah,
move
yeah.
on to the next question, sir. Now that
Yeah.
you've told us what are the mental health conditions that students suffer from, what is the treatment for such poor mental health?
So now to address poor mental health treatment and all, normally mental health treatment depends on the type of mental illness an individual person is experiencing. Treatment is also based on severity and chronic conditions. One can access such treatment from a therapist who is a qualified psychologist. There are many such doctors, uh, especially psychiatric doctors, who operate from government and private hospitals or run independent clinics. Such information is also available on the internet.
Thank you, Shiv Kumar sir. As we all know that you are also a recognized psychologist, so just a follow-up question: where do you run your practice, sir? Do you also work with the hospital, or is it an independent practice?
I go to three hospitals, like one is Aster CMI multi-speciality hospitals, where I provide this psychotherapies for cancer patients. So similarly, I go to Air Force Command Hospital in Bangalore. So where I happen to cater to the all the needs, like right from soldier to the air marshals. So they all have. It has become a mandatory for them to have a consultancy with the psychologist before undergoing any sort of operations. Similarly, I go to Indian Cancer Society. In Cancer Society, we have Karuna Shray. Karuna Shray is a trust where I get all types of patients, right from stage 1 cancer 1, stage 1, stage 2, stage 3, stage 4. Apart from that, I have a private clinic also where I consult all types of patients, mostly like from children's, even adolescents, geriatrics, even family counseling, so even career guidance.
Thank you so much, sir, for sharing your life and work experience with us. I think you have interacted in your professional capacity with people of all walks of life. You've
Yeah, yeah,
treated people in service, treated people who are already struggling with cancer, their women, their children. So I think my next question, you'll be the best person to answer this. That since
yeah.
you've seen that there are a variety of people from various backgrounds in society, you have underprivileged community, you have the socio-economic factor. Is treatment for poor mental health accessible to all people in India, especially the underprivileged community?
Yeah, yeah. Now that is a main concern of the government also, and as well as our community and society. So, in this line of action, there has been an attempt to fix a cyclic link between a mental health and a poverty in India. The government, doctors, and businessmen have taken actions which aims to increase treatment and guarantees more rights to persons with mental illnesses. In 2016, the Indian Parliament passed the Mental Health Care Act. So again, the legislation provides for state that anyone with mental illness in India has a right to good quality and affordable health care. The individuals with mental health now have a guarantee and informed consent, the power to make decisions, the right to live in a community, and the right to confidentiality. And anyone who violates or infringes on the right of those with mental illness is punishable by the law. Again, awareness pertaining to mental illness is a low in the rural sections of India. Uneducated individuals are not capable of recognizing the state of their own mental health because they do not understand the concept of mental health itself. They are not aware of the fact that mental health is scientifically accepted issue. There is a notion that merely being sad or low is okay and fixable by oneself. But such is not always case. The patient have to rely on doctors and medicines. Hence, the Constitution of India envisages the establishment of new social order, and it directs the states to record improvement in public health as one of the primary duties and aims at securing health for all. There have been many government schemes for promotion of mental health. Especially in 1982, the government of India launched the National Mental Health Program for the treatment of mentally ill individuals. There are many helpline services, even suicide prevention helplines like Sneha in Chennai, Asra, these are the NGOs, Asras in Navi Mumbai, Samaritan Sahara in Kolkata, and Asha in Chandigarh.
So now that we have talked about your interaction with patients and you know how the society reacts, how the government has reacted to mental health, we have seen the state part of it, we have seen what the government and doctors do. Now let us talk about the public. In your opinion, do you feel that the Indian society accepts positive discussion on mental health?
Actually, Indian society in general has a stereotyped views about mental health. They have a stereotyped views about mental health and how it affects people in the community. Many people believe that people with mental ill health are violent and dangerous. But the truth is, patients are more at risk of harming themselves than harming others. Ignorance and stigma tends to make people think that poor mental health occurs due to black magic. Often people seek treatment from local healers as well as local temple priests. So mental illness are considered equivalent to craziness, which is why families do not wish to disclose that someone is mentally ill. Indian households also do not engage in talks on sex education, peer pressure, ragging, bullying, social media presence of children, which is why all students handle the stress of such issues alone. It is primarily because of this communication gap the parents do not understand their children's mental health. So it is a dual error effect. Indian society, in the grab of culture and tradition, have maintained a communication gap with their children, and this has resulted in an increase in poor mental health of children and students. Our Indian society has a different take on mental health. The stigma around mental health illness is fueled by many misconceptions. Hence, removing these myths is the first step towards reducing the stigma and discrimination and facilitating better access to the mental care. There are many wrongful considerations like, does seeing a psychologist mean that I am a crazy? Second, mental illnesses are not real illnesses. Third, children do not experience mental health problems. Fourth, mental illness are caused by personal weaknesses. Fifth, people with mental health problems are violent and unpredictable. Sixth, mental illness are lifelong, never recover from it. Mental illnesses can be treated by prayers or by doing witchcraft, magical rituals, and positive thoughts. There is nothing that can be done someone with mental health problems.
I think, sir, what you've said right now is spot on correct, because as you mentioned, the 7 8 assumptions that Indian society has about mental illness, I have personally heard people say all of this. My family was of the view that mental illness and all is just in the head, and ऐसा तो कुछ नहीं, आप थोड़ा sad feel कर रहे हो, आप ठीक हो जाओगे. But then eventually studying the issue further, reading case studies, talking to people made me realize that it is just like physical health. आपकी अगर टांग टूट गई है तो आप ये नहीं कह सकते it's all in your head. Your leg is broken, you need treatment.
Yeah.
And I also would encourage all my peers and all the audience that is listening to us today to please talk about mental health and do not engage in such assumptions. Mental illness is not craziness. Sir, now that you've said that the public doesn't accept mental health illnesses, discussion on it, what do the patients have to say about this? Do the patients acknowledge that they are mentally ill?
As I have mentioned before, the stigma in society disallows patients to accept their mental illnesses openly. Such individuals are prone to ridicule, social judgment, and this often escalates the stress in the patients. Thus, people choose to keep the hush around the matter of mental health intact. Many times, the stigma prevents patients from getting the support and help they need. Because to get treatment, one has to acknowledge the mental disorder. And the same is difficult in this society.
Absolutely right. So, in fact, I feel that there is no lack of action. I mean, there are doctors like you, the government is taking so many steps, but until the people themselves don't accept and realize that this is an issue, all of these directives will not really work. So, since we are talking about awareness over here and you are here with us today, what is your advice to the student audience that we have today?
So, my advice to the students that mental illness is a common problem. It is not a, nowadays it has become like a physical health. Mental health is also need to be taken care. When both physical and mental health are in balance, then the real personality of the person comes, and he can perform well in the society. So mental illness is a common problem In fact, 1 in 5 people will experience some sort of mental illness in their lifetime. So do not be afraid to reach out for help. Your family doctor is a good place to start with. Doctors are obligated to maintain professional privilege, which means that they cannot disclose any of your details to anyone. Also, talk about the cause. Among your friends and peers, initiate a healthy discussion that aims at destigmatizing the issue. Communicate with your elders also, parents and teachers. Educate them also. Generational gaps often result in such stigmas. It is up to the youth of today to lead the charge and create change.
Absolutely, sir. Thank you so much. To the entire student community, whoever so is listening to this, I think sir has given us a solution out of all this. That is that if you do not have anyone from the society, that is your friend, parent, or teacher that you can approach, you must feel free to approach a doctor, a professional psychologist. Because as I'm also a law student, and I'm also aware that there is something known as professional privilege that is maintained between any doctor and patient. And like sir said, once you have acknowledged that you have mental illness, the best thing to do is to seek treatment for it. And like sir said in his second part of his answer, that not only action but also awareness building is required. So Shiv Kumar sir, now this brings us to a very, very important point, and this is my most important question to you. We have talked about the stigma and how it hinders patients from getting treatment. So, if someone in, let's say, my family or in the society is not supportive of treatment, what can I do? What can that person do to seek treatment?
Yeah. This is a good, this is a good question because many of them they don't know what to do. So in this aspect, I tell that there are many free clinics that offer mental health therapies. You may approach any such institutions. Many NGOs and organizations are also operate in this field and can get you help you need. The key lies in acknowledging the problem. You face stigma, but it is important not to bow down to it. Remember, for every person who stigmatizes mental health issues, there is an advocate who talks about it openly. So you are already a lawyer, Namrata. You can know better in this. So you can throw your remarks. So there is an advocate who talks about it openly. So you are not alone. And the same works the other way around as well. If you know someone who is going through hard time, it is important to respond sensitively and to aid them in getting a medical diagnosis. There are a number of ways to encourage, help a friend, a relative, or colleague to talk openly about mental illness. It is important to provide an open and non-judgmental space with no distractions. Build up a rapport and a relationship of trust to speak courageously. Make sure you do not concoct assumptions or jump on your own diagnosis or solutions. Ask open ended questions. Talk about well being with unconditional support. Listen carefully and understand and paraphrase their concern. Provide professional support and set boundaries and limits.
Absolutely correct. So I think that the action should be twofold. That first is that you recognize that you have mental health issue, but also that you react positively to someone who might be having mental health issues. But at the same time, like you said, sir, that there is a difference between having a reaction and an overreaction. So you should,
Mhm.
create a non-judgmental space. You should ask open-ended questions, like you said, and you should not give a medical diagnosis. That you should leave up to the doctor, but you can definitely extend a hand of support to your friend. So there needs to be a balance. You need to, sensitively handle the situation, like you said. And I think this brings us to my last question, and this is the most pertinent question, sir. Since that we are addressing student community today, how can the education system of India, that is the schools and colleges and universities we have, how can the education system aid in creating awareness about mental health?
Yeah, that is a good question, and now this is a prime, prime route for addressing the issue. That is for the schools and colleges, as the NEP, this new education policy. Even I am of the opinion that there should be one curriculum for mental health course also, which should be included right from the school level. So education, like schools and colleges, are microcosmos of the world around us, which is why it is imperative to sensitize students right from a tender age. That is right from the school, right from the school. Normalizing discussions and discourse about mental health at the school level will create a generation of people who will not stigmatize such an important issue. There must be good quantity of discussions between educators, students on the issue. Students must be exposed to role plays, like that case studies, role plays. So all this make awareness, so throw more, relevant seminars and talk shows can be organized for students to better understand this issue. From including mental health narratives in the academic curriculum and removing discrimination and allowing early detection to empowering stakeholders, the education system yields myriad opportunities for enhancing mental health awareness, regularly organizing free mental health screening, sharing information locally, spreading messages to those in need. Taking time for your own mental health is a key to being a mental health champion. But mere discussion is not enough. In practice, schools and colleges must tend to the mental health needs of their students. There must be a system of addressing the mental health of the students. Engaging a counselor in every school and sensitizing children about visiting counselors in times of need is also a step worth taking. A procedure for therapy must be established in every school where the privacy of the student is intact. Relationship of the trust must be built between the teacher and students. Often, teachers complain to the parents of the child when the child confides in the teacher. Such only erodes the student's confidence. Instead, the school should sensitize and guide the parents as well as when the child is showing symptoms of mental illnesses. At college level, every institute must create a center for mental health that advocates the positive discussion of mental illness.
So great ideas. And I mean, I studied in a school for 12 years. And I was
Right,
in
right.
one of the finest schools of my state, but not once, even in high school, was the issue of
Mm,
mental health discussed. And especially for
mm,
board years like 10th and 12th, there was a lot
mm.
of brain cracking stress that students had, but we were not allowed to discuss it because that would be a sign of weakness. That is the stigma that
Right,
we
right.
talked about today. So I think the policy interventions and the solutions that you have mentioned are absolutely worth taking note of. The idea of awareness creating through role plays and dramas and seminars, I think that will allow students of a tender age to actually perceive that situation. When you are in a role play or in a drama, you're living that role. So that can be a very small start to normalizing the discussion on mental health. And like you said, that there needs to be a relationship of trust between teachers and students. We need to have a very trusting relationship with our educators where we can confide in them. So I think, sir, it has been great hearing from you. You have talked about so many aspects. You have talked about your own life, work, society, government, public, and it has been a very enlightening journey for me to be interviewing you, as I'm sure it is going to be
Mm.
for our audience who is going to see this interview now. Any closing remarks, sir, you have for your audience?
My yeah, I am also thankful and grateful for you having interviewing me, and my opinions or my experiences which are being shared to others, which will help them in their day-to-day life, and also improve their quality of life also. So that way I think this you have made a better platform for me to reveal whatever the experience I gained and I have achieved, that should be then passed on to the students community.
I think keeping in mind all of the gems of advice and knowledge Shiv Kumar sir has been kind enough to share with us. We from the entire team of IDEA, Shiv Kumar sir, thank you for taking time out of your
Yeah,
busy schedule and talking
thank you,
to us.
thank you,
Thank you so much, sir. Thank you.
thank you, thank you, thank you, ma'am, thank you.